And so if we look and I'll speak to the North Texas, Dallas-Fort Worth area a little bit and say, okay, well, let's talk about hospital prices and how's all this working? Why do we have to make this a political issue?
Yeah.
So, um, on average in this community, after negotiated discounts, so if you're going in network, we'll start with Medicare. So let's assume Medicare is about break even, about your cost of doing business as a hospital. That's about what you're going to get for a Medicare patient. Um, so you need to get other patients that aren't Medicare to have
To pay,
to
yeah,
make
pay the
money, pay the
bills.
bills, and keep growing. So okay, got that payer mix strategy. I need more than just Medicare or Medicaid patients. I need some private insurance
Mhm.
patients. So you look at the Obamacare plans, individual marketplace, which the government ultimately approves or doesn't approve the ultimate insurance rate. So the insurance companies are taking the risk. So in this market, they're going to pay that hospital probably 40 to 50% above what Medicare pays
Okay.
for those plans. Then you take everybody else who has insurance through their company, with a good network, a Blue Cross Blue Shield, United, Cigna, the bigger networks that are there. You go, okay, so and if I have that, how much are they receiving? Well, those negotiations after discount are more in that 250 to 300% of Medicare.
Oh, okay.
So people wonder, well, why is my insurance so expensive at work?
Right.
And you go, well, for services, we're paying 3 times the cost of what Medicare pays. So there's a hidden Medicare tax
Yes.
inside of this entire system. And Dallas Fort Worth is an expensive marketplace. Some places the gap is less. It varies by region. But healthcare, in my opinion, is a social service. It's a social it is for the public need. We need this here. And so is it a social program? Is it a private program? I don't know. That's for the red and the blue team to argue. Um, and the bottom line is the red and the blue ultimately have to come together
Mhm.
in something that makes it affordable. So if the health insurance is not affordable and what's become not affordable is less that per paycheck and more of the deductibles and out-of-pocket limits.
Yeah.
Those have skyrocketed.
Yeah.
And so if you've got a person that is, let's say they're making $60,000 a year. They're making $60,000 a year and they've got a $5,000 deductible and then a $10,000 out of pocket limit.
Uh,
Do you think that they've got that ten to $15,000 saved up for
no.
a healthcare fund? No,
Mm, mm.
they don't. They're likely either just starting to build their savings because they're young and getting going in their career, or they've got other expenses and paying off other debts and are living paycheck to paycheck. That's the reality
Yes.
that's there. And another study that has been done has looked at the concept of underinsurance.
Mhm.
And so pre-Obamacare, we were the real discussion was the uninsured, people who have no insurance.
Mm,
That number of Americans has gone down
that's
significantly
good.
with Obamacare, but we have replaced it and multiplied it
Mm.
now with the underinsured. And what underinsured, and this is also Commonwealth Fund, the underinsured is people who have insurance but couldn't afford it if they actually had something go wrong.
Wow.
So yes, I have health insurance,
Yeah.
but if I needed a major surgery,
I mean, not paying for it.
I I
Yeah.
I don't have the deductible and out of pocket, though those are not sitting in the bank,
Right.
just waiting.
Yeah.
And I think that's a lot of what our system has done
Yeah.
is employers have been so conscious of trying to lower costs because the price of services, I'm paying 3 times Medicare for services.
Yeah.
I can't afford that as an employer.
Yeah.
So I keep raising per paycheck. Well, then that got too high. Then I'm now going over here and saying, well, here's my deductible and my out of pocket. We've pushed it down. And that is that voting group that's very sensitive to the shutdown. So if you
Winds it
kind of
all up.
if you wind it all, this intersection of politics and money and healthcare,
Mhm.
ultimately, this unaffordability, the anxiety, if something goes wrong, I can't pay for it, even though I have insurance,
Yeah, it's awful.
is a voting group
Yeah.
that is very powerful when activated